I was wanting to have a conversation about resistance because I think that that's just another normal thing that people experience when they're feeling really awful,
Right.
when you
Right,
have
right.
all those physiological sensations of anxiety, when you have all those worry thoughts. And it's really typical just to think, I don't want to feel this way anymore. They come to see us hoping that
Right.
we're going to help them not feel this way anymore.
They want us to have the magic wand.
Yeah. And so they're just kind of in the habit of over and over again just pushing away from it or fighting it. If those of you who might be ACT trained, acceptance and commitment therapy, it's the idea of the rope and like tug of warring with anxiety, right? And so that as long as you are engaged with it and fighting it, it's going to have power. So, I don't know, do you have an example at all of a client that is someone who just really worked hard at not wanting to feel this way?
I have a client who the whole, I'm just getting started with this client, and the whole concept of feeling anxious is just so distressing to him. And what's happened for him in his life is so terrible as he's avoided feeling any anxiety by things just have closed in on him. And so he has such a limited life. He doesn't go out very much. He has very limited places that he goes because just the whole experience of feeling anxious feels, he just feels like he can't do it.
Yeah, so I have a great thing that I show my clients when they're in that kind of an experience, which many of our clients are,
Right.
is this idea of he has resisted feeling anxiety, and what he figured out was, if I don't leave the house, if I don't drive the car, if I don't do anything that might trigger my anxiety, then somehow I'm safe. But guess what? The reason he's seen Elizabeth is because he's still feeling anxiety, right? So we have these finger traps, and you can just get these on Amazon or a local toy store or something. And I don't know how many of you are, in the generation where we used to play with these.
Right.
But we keep these in our office, and we ask clients, again, without saying much about it, we ask clients just to, would you be willing to, play with this a little bit? This is something that you stick your fingers in both ends, and then just see what happens when you try to get them out. So what's your experience with that, Elizabeth?
Right, and you feel it tightening down and tightening down. As you pull on it, as I'm pulling away, it's just tightening and locking my fingers in place. It really feels like they're locked in. The more I pull, the more locked down they feel.
So you're saying something really important. Let's just talk about that related to, anxiety. The more you pull, the more locked down you feel. Is there any way you can connect that to anxiety right now?
Right, because the more we don't want to have that feeling, the more we're having that feeling.
Yeah,
The more
and
the feeling
locked
grows.
down. Like when you use the word locked down, those, by the way, our clients give us this stuff in session. All you have to do is give them an experience, right? And you say, so what's that experience like for you? And Elizabeth just kind of organically said that, and I was like, locked down, right? Her client is locked down in his house. And so the more we resist, the more it persists. So that's a mantra that we use in therapy, and we demonstrate
and you
it.
See it here.
Yeah.
So if you have one of these, you can feel it too. If you have a client, you can have your client feel that too. There's nothing like the experience of feeling something like this to really put it in your mind like, I see what resisting and persisting have to do with each other. But how do we get out of this?
Yeah. How do we get out of this?
How do we get out of it? You got to think. So what's the opposite of resistance, right? What's the opposite of pulling away? The opposite of pulling away is moving towards, right? We have to move towards the thing. I have to push my fingers together, paradoxically. And we talk over and over again about the paradox of anxiety.
Face it, feel it, and do the opposite.
Right.
We're going to say that over and over again in our videos because that is what we want our clients to be able to do, is to face what they're feeling and accept those feelings, right? Feel them, and it's one of the things I say to my clients all the time, it's okay to feel anxious.
Right.
And then to do the opposite.
Right.
And that's what that shows.
And you get your fingers out when you do that. And again, having your clients experience that is just so wonderful.
Yeah, I was just thinking, we're at the Anxiety and Depression Association of America conference right now, and we have a table here in the exhibit hall demonstrating all the things that we teach in our trainings. And so we have a whole bunch of these finger cuffs off, and this afternoon, several people came up and they're like, oh my gosh, I love using the demonstration of the finger cuffs. Can I have a bunch of these? So once you get into using these props with your clients and you see how powerful it is for them to have these experiences,
Right.
you're going to want a whole bunch of finger cuffs as well.
Yeah, we just want to give you as many strategies to be a wonderful therapist with your client because we need more therapists. So keep up the good work, and thank you for being here with us for this video.